Okay, hi, my name is Jamie Corsa. Today I'm going to be demonstrating how to draw medications as well as intradermal and intramuscular injections. So first I am going to perform hand hygiene. I am outside my patient's room and I have my MAR as well as my provider orders and some of the supplies I need. So first I am going to just compare, make sure that everything matches up. So at 0900 we're going to administer Shirley Cost and make sure it's the patient's name, Shirley Cost, 54, female, Shirley Cost, 54, female. I want to make sure date of birth, 5/14/64, 5/14/64. So then we're going to start with our medications to draw up. Purified protein derivative, diluted 0.1 mil, as well as purified protein derivative, 0.1 mil on right arm. We are then going to do ceftriaxone, which says 250 milligrams, ceftriaxone 250 milligrams, and then Phenergan 25 milligrams IM twice a day as needed. Phenergan 25 milligrams IM twice a day as needed. And for this ceftriaxone, we are going to have to do a dimensional analysis, so that comes out to 1 milliliter. As well as the Phenergan is going to come out 0.5 milliliters after we again do our dimensional analysis. So since I've already washed my hands and everything, I am going to take out what I need. So here we have the purative protein derivative. Then we have the ceftriaxone, the 1 mil, and then right here in our ampule we will have our Phenergan. Okay, so after I have all that out, I am then going to don gloves. Okay, take out my little tray here. Okay, so first I'm going to start with the purified protein derivative. So I am going to, I want to pop these off here. You want to make sure that you get a alcohol wipe. And you want to rub the top in circular motions here and throw away, as well as another one for the other. Okay. So because we have to dilute that, we are going to grab our syringe here. And first we are going to pull in some air here, and we're going to make sure you're going right in the middle there. You want to put air there, flip, I'm pulling 3 milliliters of water here, a little sterile to dilute. Okay. Just want to make sure there's no bubbles or anything in there. I'm then going to insert into our powder here. Inject it. Okay. Then I'm going to take this safety and make sure it's on and put it in my sharps container. And then we want to mix this together. We don't want to shake it, so we'll just rub it back and forth here. Make sure it's good. Okay, so now that we have that mixed up, we're going to take our 1 milliliter syringe here. And we are going to take out 0.1. So I'll flip it upside down. Make sure it's at 0.1 there. There we go. And we just want to make sure that we have no bubbles. So just give it a little flick there. Okay. We'll then put the cap back on. And then we will take our label here, and you always want to write down your label with all your information, and then we will just label it. And then I'll put it here on my little tray. Okay, so now that we are done with that, we are going to move on to our ceftriaxone, which is, with our dimensional analysis again, is 1 milliliter. So off. Again, making sure that you are cleaning the tops. Always clean the tops. Get another one here. And this. Okay. Syringe out, and we are actually going to use just a little bit of a different needle here so we can mix our medication here for the injection. So again, we're going to pull some air, so about 3 milliliters of air here, and then you just want to inject into there, making sure that's getting air, and then we will flip. And we will take out 3 milliliters. Perfect. Again, just making sure that there's no bubbles. It's 3 milliliters. And we will inject it into our powder here, our ceftriaxone. Making sure we're scooping our needles up. You don't want to grab it because you don't want to get hurt there. And then again, mixing it in between our hands, rubbing back and forth. Okay, when that's done, again, we'll take our needle here, and since we are getting 1 milliliters, this time we want to draw 1 milliliter of air, and you want to put air into the vial here, and then we'll flip it. There we go, we got her now. So just want to make sure that we're pulling 1 milliliter. There we go. Making sure we get that air bubble out there. And then we'll just put the lid back on. And we will label it and set it on the tray. Okay, next we will do our 0.5 milliliters of Phenergan. We are doing that out of an ampule. So what we want to do is, first I'm going to disinfect around the vial here, the neck of the vial. Then I also want to make sure that there is no liquid in there or anything. Want to make sure it's empty. So to do this, since you're going to be snapping it, you want to take a pad here and a gauze pad, and you always want to break away. So you want to wrap it around, and you want to face that way and take it towards you, so you're breaking it away. So if any glass shards or anything. Put that in the sharps container. I'll do that. Okay. So I'll take my syringe, and here I have a filter needle because I want to make sure that I'm filtering out anything. Because it is glass, you just want to make sure that you're filtering out if there's any glass in there or anything that can happen. It can be dangerous. So I will take this, and again, drawing 0.5. Want to make sure you're not touching the neck of it. Okay, now that we got that, made a little bit of a mess, want to make sure again, getting the bubbles out here. We're going to scoop our lid, take out that, put it in the sharps container, and there we go. After that, we will again label. We have everything on our tray here. Want to make sure that we're just throwing away any of the extras and also disposing everything in the sharp container or in the garbage. Okay, so now that we do that, I would take off my gloves, and then I would enter the patient's room. So in the patient's room, because I'm just going to leave my gloves on during the video, I would make sure that I wash my hands again, and then I would also don gloves again. I would walk in and introduce myself. Hello, Shirley, how are you today? I got a couple injections here that we're gonna do. Just real quick, I just want to verify your name on your wristband and your date of birth. Okay, Shirley Koss, date of birth 5/14/64, perfect. And then we also want to make sure to check their allergy wristbands if they had it. You're allergic to codeine. Okay, perfect. Okay, so now that we do that, we're just, we'll first start off with our first injection, which will be our intradermal injection. Also, that will be the purified protein derivative. So right here, I want to make sure that I have enough wipes, Band-Aids, and everything labeled. So first I will do the PPD test. So I'll just take the label off here. Okay, Shirley, I'm going to give you a injection today. It's just going to be here on your right forearm there. So this will, yeah, okay. So what we want to do is first we want to take the needle off. Actually, we don't want to take the needle off. We want to take a swab here and clean the area that we're going to be injecting in circular motion, making sure that that's good. Yeah, sometimes it's a little cold here. Okay, so then we will take this. We want to take the skin here and kind of give it a little spread. And when you insert your needle, you always want to be bevel up. So when you insert, you want to be at about a 10 to 15 degree angle here. You're just going to feel a little pinch, Shirley. There we go. And then after you do that, since your dominant hand is on your syringe, you want to take your non-dominant hand here and hold the needle while you're injecting, making a wheel. It's a little wheel, but it's a wheel. And then after that, you want to take a cotton thing and just dab around. You want to also put it in the sharps container. Then you want to take a pen and you want to draw around, right around where you injected, so they can see the size or if it's grown or anything. You then want to date it, initial it, and write the time on there. Okay. And then after that, you just want to instruct the patient, you know, no itching it, don't rub it in. You don't want that little bubble to go away or anything to seep out. And then we will be all done with that. Next, we have our intramuscular injection, so which is the Phenergan 0.05 milliliters, and we are going to put that in to Shirley's arm here. So first what we want to do is, Shirley, I'm going to put an injection right here into your arm. So first I just want to wipe this off, make sure that it's all clean here. Circular motions. Okay. I also just want to get a Band-Aid ready because we'll put a Band-Aid on there, as well as have my gauze. Okay. Okay, so what I'm going to do here to give an intramuscular injection, again, bevel up. I want to have this in my hand here. So because this is a child, I'm actually going to have them laying down, which is okay. So just want to make sure that you can see this. So you always want to do it at a 90-degree angle, kind of like a dart. And then we will just go 3 fingers down. So we'll be giving the injection right here. And then we'll just insert. And you want to inject slowly. And as well as the same one as intradermal, when you're done holding the skin, you always want to grab your non-dominant hand with the end so you can inject with your dominant hand. And when you are all done, we will pull that out and we'll just place that right there just in case that there's any bleeding or anything. I will check my safety and enter that into the sharps container. And also sometimes you just want to like rub the muscle around, or rub around the injection site, and then we will take a Band-Aid here and we will put it right there. Again, we'll tell the patient, you know, your arm's probably going to be a little bit sore. And then we also want to, with intramuscular injections, we always want to come back in about 15 minutes or keep an eye on your patient for 15 minutes to make sure that everything is okay and there's no leaking, bleeding, or anything like that. So that is all finished. Purposes of the video, we are not doing the ceftriaxone, but it has been done. And then I would just ask Shirley, Shirley, is there anything else I can do for you? Did you need help to the bathroom or anything? No, okay, well, all right, I will be in about 15 minutes to check on you and check on your arm here. And I would then walk out of the room. I would make sure everything's cleaned up. I would document, initial everything I had to do, as well as hand hygiene.